definition that you're seeing here is new as of 2023. ASRM updated their definition to include social infertility, which describes when someone wants to become a parent but is unable to due to their social or relational circumstances. So here you have this three-part definition. Infertility is defined as the inability to achieve a successful pregnancy based on a patient's medical, sexual, and reproductive history, age, physical findings, diagnostic testing, or any combination. Also defined as the need for medical intervention, including but not limited to the use of donor gametes or donor embryos, in order to achieve a successful pregnancy, either as an individual or with a partner, and in patients having regular, unprotected intercourse or utilizing therapeutic donor insemination, and without any known etiology for either partner suggestive of impaired reproductive ability. Evaluation should be initiated at 12 months when the female partner is under 35 years of age, and at 6 months when the female partner is over 35. So this is that newer, more robust, more inclusive ASRM definition of infertility. A little bit on prevalence of infertility before we get more specific. Infertility affects 10 to 15% of couples per the American Society of Reproductive Medicine. And per the CADC, some stats go as high as 19%. All of these numbers do not include social infertility, which we imagine would make these numbers quite a bit higher. Infertility does affect men and women equally, which is a pretty common misconception that this is more often a women's problem, and that's just not true. So a third of cases are attributable to the male partner, a third to the female partner, and a third to either both partners or unknown etiology, commonly known as unknown infertility. So briefly, to go through kind of the most common causes, age is a common cause of infertility. So a healthy woman in her 20s has a 25 to 30% chance of conceiving each month, but by 40, the chance is down to 10%. Problems that exist in the ovaries, problems like PCOS, thyroid disease, other hormonal disorders can impact ovulation, causing infertility. Fallopian tube problems, so blocked or damaged fallopian tubes can cause infertility. This can be caused by endometriosis, surgeries, scar tissue, or history of STI. All of those things can contribute to blocked or damaged tubes. And then problems related to sperm count. So when they look at sperm, they look at three factors. One is how much sperm is present in the ejaculate, what their motility is, which means how are they moving, and their morphology, which means how are they shaped, and then not being able to make or ejaculate sperm.
So fertility problems can trigger and exacerbate mental health problems, and they can also create sexual dysfunction where none existed previously. So even if a couple was like all hunky-dory before, new issues can kind of pop up as they're going through the fertility process. Can also change the meaning of sex, right? And Gabby spoke to this too. Fertility struggles can really shift sex away from pleasure and intimacy and can really alter couples' sexual scripts, which is kind of the way that a couple typically goes through sex. So, it might look different during the fertility process. It might look different even after the fertility process too. Sexual dysfunctions can also interfere with fertility. So when thinking about that, we're thinking about genital pelvic pain and penetration disorders, erectile and ejaculatory disorders. Those can interfere with becoming pregnant. However, and I think this is most important, those instances are way less common than sexual health issues arising as a consequence of going through the infertility process. So it's really, honestly, quite rare that you're going to get a client or work with a client where a sexual health issue is the main contributing factor to a fertility problem. So I think, I don't know, that's helpful to know. And then also sexual problems related to infertility occur frequently. Now, this stat to me that I'll tell you was shocking when I first read it. So estimates range that 10 to 60% of couples, 10 to 60% of couples experience sexual health concerns as a consequence of going through the fertility process. And also, the dissatisfaction, these issues can persist long after treatment has ended, also regardless of outcome. So even if the couple had a positive outcome, so was able to get pregnant and have a child, that does not in any way, shape, or form have an impact one way or another on the sexual health concerns. So thinking about these clients that you guys might be working with, if they're sitting in this space with you and they went through fertility treatment years ago, don't assume that those issues are done and gone and totally fine now, and making sure to really create a space to ask them about like, hey, how are you feeling about your sexual health? Do you have any concerns? What are things you would want to work on? Because according to this research, these concerns can pop up and can stick around for a really long time.